Hi, good afternoon, sir and classmates. We are the group two, as well as we are the first reporters for this case study activity. So, the case studies that were assigned to us entails two systems, the endocrine and the circulatory system. So, for this afternoon, we will act as doctors, but not in a professional way, just a mock. So, without further ado, let's begin. So, for the content outline, we will briefly discuss overview of diabetes mellitus, to familiar the unfamiliar terms, and to answer the two case study questions. So, the first case study that we will discuss entails the endocrine system. So, let's read first the problem. So, LJ.
So here's the case study question. Sally Sanchez, a 45-year-old woman, has been admitted to the public hospital due to a wound located at her arm not being able to heal for 2 weeks already. Apart from that, her workers have mentioned that she passed out due to overfatigue. Reason why she was rushed to the hospital. Sally is unconscious at the moment, so her co-workers did all the talking. They mentioned that prior to passing out, she is sensitive to heat for she was extremely irritable and was constantly sweating. They also mentioned that Sally took 3 separate meals prior to eating lunch. According to past medical records, Sally has a family history of diabetes.
So, yun. But first of all, you've noticed that there was a disease that was mentioned on the study. So, before going in and answering questions, we've prepared some frequently asked questions to give you a brief overview about the disease. And here, particularly, it is the diabetes mellitus. So, for that, let's have Mary Angela De Paz to take on the presentation.
For diabetes mellitus, next slide. Ayan, it is simply known as diabetes, and it is when the pancreas doesn't produce enough insulin to control the amount of glucose or sugar in the blood. It happens when your body isn't able to take up sugars into cell and use it for energy, resulting in a buildup of extra sugar in your bloodstreams. So here we will present the normal blood sugar levels. Blood sugar levels differs for different age range and time of the day. These are the normal blood sugar levels of different age groups, and those that are in the table are the levels of age group with diabetes. So you can just read through this para makita nyo yung difference. So yeah. Many people will not start to experience symptoms from high blood sugar until their levels are at 250 milligrams per deciliter or higher. So the highest blood sugar level that's considered safe will depend on the person and whether they have diabetes, but will typically be between 160 to 240 milligrams per deciliter. So for the next one, we'll discuss different types of diabetes. First, we have pre-diabetes, or this is when your blood sugar is high but not high enough to be diagnosed as diabetes. This is the stage before type 2 diabetes. So high sugar level, the normal, but not high enough to be officially diagnosed. Next, we have type 1 diabetes. This is called insulin dependent diabetes as individuals that have this have to take insulin every day. It was used to be called as juvenile onset diabetes because it often begins in the childhood. So usually yung mga babies yung may ganito kasi it's an autoimmune disease, meaning the body attacks itself. So it happens when your body attacks your pancreas with antibodies damaging the organs, making it not produce insulin. This also comes with many health problems. So it damages tiny blood vessels in the eyes called as diabetic retinopathy or nerves or diabetic neuropathy and kidneys or diabetic nephropathy. So people with type 1 also have a higher risk of heart disease and stroke. Lastly, we have type 2 diabetes. So this is when your pancreas usually creates some insulin, but it's either it's not enough or the body doesn't usually use it like it should. So insulin resistance also happens when cells don't respond to insulin. So it usually happens in fat, liver, and muscle cells. So it is minor than type 1 diabetes, but can still impose major health complications, especially in the tiny blood vessels in the kidneys, nerves, and eyes. So it is also common to people with obesity as it causes insulin resistance. This makes the pancreas makes more insulin, but still not enough to keep the blood sugar levels to normal. Yeah, next we'll talk about how diabetes affect the body. So we know that diabetes can be a serious problem when not treated immediately and can result to several long-term problems and effects in the body. So it can damage large and small blood vessels, which can lead to heart attack and stroke, and problems with the kidneys, nerves, feet, and eyes. So diabetes can be a serious problem if not treated and diagnosed early. Yun. Next, we'll discuss about the symptoms of diabetes. So common symptoms includes urinate or pee a lot, often at night. Usually they are very thirsty and they lose weight without trying. Some are very hungry and have blurry visions. They also feel numb or tingling hands or feet, feel very tired and very dry skin, have sores or wounds that heal slowly, and have more infections than usual. Symptoms of type 1 diabetes can include nausea, vomiting, or stomach pains. Yeah. For the causes of diabetes, the cause of type 1 diabetes is unknown. It is usually from the body's immune system, which destroys the insulin producing islet or islets of Langerhans cells in the pancreas. So, other causes may include genetics and family history and exposure to viruses and other experimental factors. Type 2 diabetes is primarily caused by cells in muscle, fat, and the liver that becomes insulin resistant. The pancreas can produce enough insulin to regulate blood sugar levels, obesity, overweight, and being inactive, and lastly, lifestyle.
So when we say risk factors, it is something that increases the chance of a person developing a disease or being susceptible in getting the disease. So Mary Angela have discussed the two types of diabetes, the type 1 and the type 2 diabetes. So let's have a brief explanation about the different risk factors of the two. So let's start first in type 1. So there are several factors that make it more likely that you'll develop type 1 diabetes, especially if you have this gene or genetic marker that makes you susceptible to diabetes, and that genetic marker is located on the chromosome 6, and it is the HLA or the human leukocyte antigen complex. So other risk factors are family history, since type 1 diabetes involves an inherited susceptibility in developing the disease. If a family member has this type of disease, one is at higher risk talaga. So, age naman, according to researchers, this type of diabetes usually develops in younger adults or in children. So, typically, children who are 14 years old receive their first diagnosis ng type 1 diabetes. Now, viral infections, according also to researchers, certain viruses may also trigger the development of this type by causing our immune system to turn against the body. So, common viruses that are believed that causes type 1 diabetes are rubella or German measles, mumps, and Coxsackie. And according to researchers also, some race and ethnicity daw have higher rates of developing type 1 diabetes. So certain races are African American, Hispanic American, and American Indians. Lastly is the geography. So according to researchers again, people who live in northern climates are more like at higher risk in developing type 1 kasi daw they are usually staying indoors, especially when it is a winter season. So more like they are really proximity on each other, potentially leading to more viral infections. While in type 2 diabetes, family history again is there, pre-diabetes or the stage before type 2 diabetes, obesity as well because of the pro-inflammatory chemicals na nire-release ng ating fat cells, triggering the development of insulin resistance of the cells. Of course, having physically inactive lifestyle or bad lifestyle or having this poor nutritional management is also a risk factors for type 2 diabetes. We're talking about the age, usually 45 years old and older. Parang doon pala nagsisimula yung onset ng mga symptoms ng diabetes. So, bakit age 45 and older? So researchers said it is because of too many factors. So ayun din, history of gestational diabetes or having diabetes during pregnancy. Lastly is having PCOS or polycystic ovarian syndrome. So the main belief cause of this is the high levels of male hormones or androgens that prevent the ovaries from producing hormones and making eggs normally. So first feature talaga nito is irregular periods as well as obesity. So genes, insulin resistance, inflammation have all been linked to excess androgen production. So that's for the risk factors of for these two types of diabetes. So next slide. So if you have those risk factors or kunyari may mga symptoms kayo like what Mary Angela has said, of course dapat magpatingin ka na sa doktor. So, doctors do screening tests for accurately diagnosis of or diagnosing of diabetes. So, of course, blood glucose measurement, yung pinakatitignan sa'yo, usually, nakikita to through blood sample. So, kukunin nila yung mga blood sample nyo. And then, there are blood glucose tests like HbA1c or the hemoglobin A1c. So it will measure the amount of your blood glucose that were attached sa hemoglobin. So according to CDC and ADA, normal levels are 4% to 5%, 5.6% and 6.5% or higher, consider na meron kang diabetes. Another test is the oral glucose test or the fasting blood sugar. So one must fast or to not eat or drink except water for I guess 8 to 10 hours. So again, blood sample will be taken. So according again to CDC and ADA, normal FBS is 100 milligrams per deciliter and 126 milligram per deciliter and above is considered as having diabetes. So next slide. So there's talking about treatment. There's no really cure for type 1 diabetes because it is classified as the having as this autoimmune disease, and because the pancreas don't really produce insulin, or so yung may mga type 1 diabetes talaga, they are usually need to inject insulin regularly. So there are two options for injecting insulin, either via infection injections or pumps, or this pumps is a small device that mimics what the pancreas do, but in terms of cost, pumps are usually costly, of course, than injections. In type 2 diabetes naman, it can be managed and even reversed with proper discipline in the diet and the exercise alone. But sa panahon ngayon, many people really need extra support. So what the doctors do is that they prescribe medications that will help their body to use insulin more effectively. But in some case, if talagang nagpalit ka na ng lifestyle and still your high blood sugars remain abnormally high, what the doctors do is that they will prescribe you na to take insulin injections. But yeah, diets, exercise, weight loss, and even education about the disease are like the cornerstones of treatment of diabetes, especially in type 2 diabetes. And these are often the first recommendation din kasi for people with mild diabetes. And of course, monitoring blood glucose by using the most affordable glucose device called the glucometer, diba, for one to be able to keep their blood glucose levels as close to normal range as possible. So, next slide. Okay. So, in terms of what diets are recommended for a diabetic person, parang there is no universal diet. Parang it tells you lang, diba, to be mindful of how you eat and to know how your body will respond to certain foods na kinakain mo. So, healthy eating or proper nutritional management talaga is really an important factor for people with diabetes. Kasi if you disregard and still continue on having this bad eating habits, diba, more likely you are really at risk on having diabetes complications. So marami-rami yung mga diabetes complications, ano. So if hindi mo alam kung ano yung mga foods na kakainin mo, yeah, you could consult your dietitian to recommend you a low calorie plan, or yeah. And can diabetes be prevented? As I've said, because of the genetic marker or viral infections or other risk factors, or because type 1 diabetes is an autoimmune disease, so it really can't be prevented. But in type 2 diabetes, as I've said many times, that it really it can be prevented and even reversed by having a good or proper lifestyle habits and being physically active. Yep. Next slide po. So how common is diabetes? So according to WHO or World Health Organization in 2019, diabetes is the ninth leading cause of death in the world. And in the Philippines, it is the sixth leading cause. And in terms of what is the common type of diabetes that is more prevalent, it is the type 2 diabetes. Because according to them, more than 95% of people with diabetes actually have type 2 diabetes. So also according to Statista on 2019, here are the three countries with highest number of diabetes or of highest number of diabetics. We have first is the China with 116.4 million, second is the India with 77 million, and pang third is the United States with 31 million. So that's it for the brief overview for diabetes mellitus. Now let's familiar some unfamiliar terms.
We have So next we have two terms which we have to be familiar with. These two terms are overfatigue and unconsciousness. So first, let's define overfatigue. Fatigue is a term used to describe an overall feeling of tiredness or lack of energy. It isn't the same as simply feeling drowsy or sleepy. Sleepiness could be a symptom of it, but they are not the same thing. There are several factors that causes fatigue, and one of it was due to the person's physical health condition. Fatigue is also a common symptom of diabetes. As what Sally have experienced, her overfatigue which leads her to faint, becoming unconscious, was probably resulted from getting high blood sugar levels and other complications of her current diabetic condition. Next is unconsciousness. When a person is not aware of what is going on and is not able to respond normally to things that happen to and around him or her, that person has just been unconscious. So here we have three types of unconsciousness. The first one is called fainting. It is the brief form of unconsciousness which happens just in a short period of time. When a person has been in an unconscious state for a longer period of time, that person is in state of comatose. And lastly, general anesthesia is where the period of unconsciousness of a person is being controlled, which are mostly done during medical surgeries. In the case of Sally, she has fainted due to overfatigue and then was brought to the hospital. She experienced the brief form of unconsciousness. People with diabetes, when their sugar levels tend to rise or low too much, they possibly could also experience fainting, as having high blood sugar can actually damage the nerves in the body which help keep the blood pressure steady. This also leads to unusual low blood pressure, which makes the person pass out. Furthermore, in severe cases, low blood sugar may also cause a person with diabetes to faint. Hypoglycemia can be caused by too much insulin or not enough food. Upon applying first aid to someone who just fainted, the person must position him or her on his or her back. Then raise the person's legs about above heart level, about 12 inches or 30 centimeters if possible. To secure that the person could properly breathe, loosen the belts, collars, or other constrictive clothing. But if the person didn't regain consciousness after a minute, one must call emergency hotline immediately. So this is the first aid for fainting for a normal person. For diabetic person, if the person suddenly get his or her consciousness but unable to eat, someone who is with them should put a little honey or other sweet syrup inside their cheek and monitor their condition. But if the diabetic person lost consciousness longer than a minute, any bystander should call 911 and ask for emergency medical help. For a diabetic person who fainted, this is the proper thing that person must do in order to to help the person to regain his or her consciousness.
So, hello, I'm Boon, and I'm gonna re-say what they said in layman's terms. So, diabetes has two types. Type 1 is insulin dependent and only accumulates 10% of the diabetic population, while type 2 is non-insulin dependent and accumulates the rest of the diabetic population. Diabetes is a health condition that characterizes by the abnormal level of glucose in the blood or simply incapability of the blood to turn food into energy. While type 1 can be prevented, type 2 can while type 1 can't be prevented, type 2 can be with the help of regular diet and exercise. So, number 4, patients are also more vulnerable. Number 4, patients are more vulnerable to heat exhaustion because diabetes can damage the blood vessels and nerves, including the nerves in the sweat glands. Patients may not be able to cool their body as effectively as it needs. Dehydration can make your blood glucose level rise. Then, you may develop a more frequent need to urine, which compounds the problem. With high glucose levels, pag nasasalang dugo sa kidney, samupit, spill into the urine called glycosuria. Since glucose is osmotically active, water tends to follow, resulting in an increase of urine secretion or polyuria. Increase of urination results in polydipsia, means unwanted dehydration. Ilang ho.
So now let's answer the two questions about the problem. So, number one.
So the first question we have is, what do you think did the doctors do to help Sally regain consciousness? Sally fainted due to overfatigue, more specifically by dehydration and hyperglycemia. Overfatigue resulted from having high blood sugar levels or being hyperglycemic. And as her blood sugar level is in abnormal status, it should be lowered down first until it reached its stability or homeostatic state. In doing so, it could be on one of the steps that the doctor would do to help patient Sally regain her consciousness. And here are more things that the doctors could do to help Sally regain.
So, yun. So, if your blood sugar is too high, you'll receive intravenous fluids, supplements of phosphate, sodium, and potassium, and also insulin. Sally is experiencing hyperglycemia. Commonly, binibigyan ng rapid-acting insulin injection. Most known brand is Novolin 730 or Novolog Mix 730, a prescription medicine that lowers blood sugar levels in the blood.
What possible hormones are problematic for Sally? Where do you think they are located? So, the hormones problematic for Sally are her insulin and glucagon. So, insulin are found in pancreatic islets and is produced in pancreas. And also, glucagon is secreted by the pancreas.
So we all know that insulin are like the main hormones responsible for lowering the blood sugar levels. So ayun po sir, parang sinama na rin po namin yung mga associated hormones other than insulin that can also affect blood sugar levels. We have the GLP-1, GIP, amylin, epinephrine, cortisol, and growth hormone. So we have the GLP-1, GLP, and amylin po muna. So these three hormones also regulates the mealtime insulin. So, whereas when the GLP-1 and GLP are released from your gut, they signal the beta cells to increase the insulin production at the same time decrease naman po the alpha cells of the glucagon production or glucagon release. So GLP-1 also slows down the rate at which food empties from our stomach and acts on our brain to make us feel full and satisfied. So people with diabetes, especially yung may mga type 1 diabetes po, they have absent or malfunctioning beta cells. So the hormones insulin and amylin po are missing, and the GLP-1 can really work properly. So and yeah, they people with diabetes cannot suppress glucagon during a meal, kaya they have these abnormally high levels of blood sugar even after the meal. So amylin naman is released on the beta cells along with the insulin. So same work as the GLP-1, suppressing the glucagon levels, which will then decrease liver's production of glucose during a meal to prevent it from getting too high. So the next three hormones are the epinephrine, cortisol, and growth hormone. So these three hormones naman po are the hormones that help maintain blood sugar levels. So along with glucagon, they are called stress or glucocounter regulatory hormones, which means that they make the blood sugar rise. So epinephrine, it acts directly on the liver to promote sugar production. It also promotes the breakdown and release of fat nutrients that travel to the liver, and then the liver will convert it to sugar and ketones. So cortisol and growth hormone, it also counterbalances the effect of the insulin on muscle and fat cells, promoting the insulin resistance. So like the adrenaline, or the epinephrine, it also enhances the production of glucose via liver. So if one have diabetes, especially again type 1 diabetes, this means that they may need to take more doses of insulin to keep their blood glucose under control. So that ends po our report for endocrine system. So may we have now the circulatory system to discuss.
Hi guys, good day. I am Catherine Joy Banta. So we are the second part of the group that will report about the circulatory part of the case study. So first is what is the content outline of our discussion? So first is the overview of the aortic aneurysm since it is the disease that we have in our case study. Then the second part will be the familiar, the unfamiliar. And the last one is the case study questions. So, our case study question is about a 65-year-old male consulted his physician about his difficulty in breathing. In the course of the physical examination, the physician palpated the man's trachea in the suprasternal notch. During cardiac systole, he felt the trachea move abnormally. Radiographic studies revealed that aneurysm of the arc of the aorta. So there are two case study questions. First is what structures may be compressed by the aneurysm, and the second one is what is an aneurysm of the arc of the aorta. Next slide, please. So here's the overview of the aortic aneurysm. Aortic aneurysm is a balloon-like protrusion in the aorta, the main artery that transports blood from the heart to the chest and to the body. So, aortic aneurysm can burst or dissect, and the power of blood pumping can tear the layers of the artery wall, enabling blood to seep in between them. Next slide, please. So, there are two different types of aortic aneurysm. First is the two locations of the aortic aneurysm is the chest, which is called thoracic aortic aneurysm, and the second one is is in the abdomen or the abdominal aortic aneurysm. So we will focus more on the thoracic aortic aneurysm since it is the disease in our case study. So the symptoms in the aortic aneurysm, they don't show up until the aneurysm becomes large or burst. But as it grows, you may notice some signs, including chest or back pain, difficulty in breathing or swallowing. Third is the shortness of breath. Fourth is coughing, and lastly is the hoarseness. So there are different effects to the body. Aortic aneurysm can increase the likelihood of blood clots forming in the affected region. So, a blood clot that breaks free from the interior wall of an aneurysm and plugs a body artery elsewhere in your body might cause discomfort or stop blood flow to your legs, toes, knees, or abdominal organs. So, there are different causes of thoracic aortic aneurysm. And it includes the high blood pressure, infection, plaque buildup in your arteries or atherosclerosis, and high cholesterol, and lastly is the sudden traumatic injury.
Hi, I'm Janela Cassandra Vargas, and for the continuation of the overview, so here are the risk factors for thoracic aortic aneurysm. First is the age of a person. Most often, thoracic aortic aneurysm occurs in people with ages 65 and older. And of course, if you have a family history of having aortic aneurysm, that means you are at risk of having one too. Means you may develop aneurysms at your younger age and may cause a higher risk of rupture. The use of tobacco or smoking was a strong risk factor too for the development of aortic aneurysm. Tsaka having a high blood pressure may also damages your blood vessels in your body. That may cause you to have a chance of developing an aneurysm. Meanwhile, build up of plaques in arteries was a common risk for the older people to have aneurysm because the fats and other substances you have acquired can damage the lining of the blood vessels. Another risk factor is having a Marfan syndrome, low, low, low is diets, and Ehlers-Danlos syndrome. The Marfan syndrome is an inherited disorder that affects connective tissue and mostly affects the heart, eyes, blood vessels, and skeleton. So if your aorta is affected, then you're at risk. Lastly is the bicuspid aortic valve, whereas an aortic valve has two flaps instead of three. Aortic aneurysm might develop downstream from the aortic valve and can lead to bleeding or rupture. So, paano nga ba nadadiagnose na may thoracic aortic aneurysm ang isang tao? Through imaging test, nako-confirm ito ng mga doktor. First is echocardiogram. It is a test that uses sound waves to capture real-time images ng puso ng isang tao together with the ascending aorta. Because through this, we can see and show how well the heart chambers and valves are working. Pero may mga doctors na gumagamit ng transesophageal echocardiogram for the better view of aorta. Next is computed tomography or CT scan kasi need gumamit ng x-rays for the body so makita at madadetect din dito yung size at shape and even the location ng aneurysm. Yun nga lang, ang disadvantages nito is na-expose yung patient sa radiation, especially for those people with Marfan syndrome since they need frequently monitoring. Another one is magnetic resonance imaging or MRI. This test naman is alternative for CT scan to lessen somehow the radiation. And it uses magnetic fields and radio waves para makakuha ng pictures and at the same time ma-detect yung size at location ng aneurysm. There are various treatments to prevent aneurysm from growing. Thoracic aortic aneurysm can be treated through monitoring. The echocardiogram, CT scan, and MRI can use to monitor the aneurysm. Alongside with it is medication. But kung ilang beses ka mag-undergo sa mga gantong test for monitoring is depends on the size and cause of your aneurysm and how fast the aneurysm is growing. And of course, medication is a must, especially if the patient has high blood pressure or may nakabara sa arteries. Yan yung beta blockers is one of the medication. In that way, it can help to lower the blood pressure of a person by slowing the heart rate. At para naman dun sa mga may Marfan syndrome, beta blockers can help to lessen how fast the aorta is widening. Example ng beta blockers ay yung metoprolol, atenolol, and bisoprolol. Next one is angiotensin 2 receptor blockers. Dito naman, if the patient cannot take any beta blockers or the beta blockers that they took are not enough to lower the red blood pressure, then they can use this medication. And this one is the most recommended for those people who have Marfan syndrome. Example naman nito is yung losartan, valsartan, and olmesartan. Last na medication is the statins. This one naman can help to lower the cholesterol at para ma-reduce yung blockages within the arteries and of course para ma-lessen yung risk ng aneurysm complications. And last na treatment is yung surgery. For surgery, it is generally recommended na if the thoracic aortic aneurysm is about to 5 to 6 centimeters na o mas malikot pa doon. Especially, surgery is needed for those who have family history and with Marfan syndrome people since they have higher risk to have aortic dissection. Sa surgery, it could be open chest surgery, whereas ito yung mostly ginagamit to repair and to remove the damaged section in aorta. And then, i-replace ng synthetic tube. Pwede rin yung endovascular surgery, but this one is not for everyone kasi kahit mas mabilis yung recovery dito, feeling ko mas or parang may too risky siya. And lastly is emergency surgery. Yun nga lang, this one is too risky din and there's a great chance for complication. That's why the doctors want to treat and have proper monitoring before the thoracic aortic aneurysm rupture. Next slide. Um, can thoracic aneurysm be prevented? Yes, thoracic aneurysm can be prevented, and one of the risk factor is smoking. So, as much as possible, if you are a smoker, you can stop smoking para kahit pa paano ay ma-prevent yung pagkakaroon ng aneurysm. Pero kung nasa family history na yan, just observe proper monitoring na lang and consult a doctor. That's why there are treatments so that to prevent aneurysm from growing bago ito mag-rupture. And lastly, how common is thoracic aneurysm? Um, Thoracic aortic aneurysm rarely occurs, it occurring approximately in 6 to 10 per every 100,000 people, and it is said to be that 20% of these cases are linked to family history.
Hi, I'm Shane. I'm going to discuss the unfamiliar systole. It is the period of construction of which the ventricles of the heart that occurs between the first and second heart sounds of cardiac cycle. The sequence of event in the single heartbeat. Systole causes the ejection of blood into aorta and pulmonary trunk. Other information is it is construction of the heart chambers to drive blood into aorta and pulmonary artery. It increases pressures in the arteries. It decreases the volume of the heart chamber and forces the blood out of them. The blood vessels are contracted in this space and systolic pressure represent the maximum pressure exerted on the arteries. Systolic pressure below 122 milligram Hg is considered as normal.
So, dito naman tayo sa may suprasternal notch. The suprasternal notch, also known as the fossa jugularis sternalis, jugular notch, or the Plender gap, is a wide noticeable depression between the clavicles above the sternum's manubrium in humans. So, the suprasternal notch is a noticeable dip that runs from the neck to the clavicles and above the sternum's manubrium. In adulthood, the trachea is close behind it, rising about 5 centimeters above it. So next is radiography. Radiography is the art and science of using radiation to provide images of the tissues, organs, bones, and vessels that compromise the human body. So
physicians who've had a special training in interpreting diagnostic images read or diagnose these images. Treatment of a patient depends on the accurate and precise production of the radiographic images. So, common misconception regarding this together with the X-ray is that X-ray is a photon of energy. This is what's being exposed to the patient para dito sa may final image. This is not the final image and X-rays cannot be seen by the naked eye. A radiograph is yung resulted image ng pasyente or ng object na na-expose dun sa X-ray.
So these are the case study questions that given to us. First is what structures may be compressed by the aneurysm? So our answer is descending thoracic and thoracoabdominal aneurysms can compress the erode adjacent tissues such as the trachea, bronchus, esophagus, vertebral body, and the spinal column.
Okay, these are the structures that may compress the trachea, bronchus, esophagus, vertebral body, and spinal column kasi ito yung malapit kung saan nabuo yung aneurysm ng lalaki.
So next case study question is what is an aneurysm of the arc of the aorta? So a bulge or weakening in the wall of your blood arteries is known as an aneurysm, and the aorta is your body's major blood artery. So when an aneurysm starts to happen in your aortic arch, which can be seen here, which is the curving section of the aorta in your chest, it is then called an aortic arch aneurysm. And an aortic arch aneurysm can actually rupture, which can pose a life-threatening situation. They can form blood clots, block blood flow, and cause the aorta to rupture or press on nearby body parts.